բաց դասախոսությունը ես կուզենայի բացման խոսքի համար խոսքը տալ Pascal Michoy.
That is not important. I'm just giving floor to you. But for anything we want to have a discussion of the microphone.
Բարի առավոտ դերևս եւ ես դեռ մեկ-երկու էլի կասեմ, բայց մինչ այդ ես ուզում եմ իմ գոհունակությունն արտահայտել, որ իսկապես հետաքրքիր հանրային դասախոսությունը եւ այս հանրային դասախոսության կազմակերպումը հնարավոր եղավ World Program-ի ջանքերով Երևանի պետական համալսարանի ժողովրդական դրներով եւ ՀՌԿ Հայաստանի կողքից աջակցության բացման խոսքի համար ես փոխանցում եմ միկրոֆոնը համաշխարհային սննդի ծնարդի բարևի ծնարդի հայաստանյան ներկայացուցչության ղեկավար Pascal Michoy.
So, dear participants, Barigarist, and I really do have the pleasure to welcome you to this seminar by Dr. Harold Alderman, which we just mentioned is jointly organized by the World Food Program Armenia, Yerevan State University, and the Caucasus Research Resource Center. Dr. Harold Alderman is a senior research advisor at the International Food Research Institute, IFPRI, and he holds a master's degree in nutrition from Cornell University and a PhD in economics from Harvard. He is currently visiting Armenia on a scoping mission for the design of an impact review, potentially, of the school feeding program in Armenia. So it is a great honor and a real pleasure for WFP and its partner to host such a talented international expert. Dr. Alderman is a worldwide known expert on school feeding and social protection. And prior to IFPRI, he has worked for 20 years at the World Bank as a social protection advisor in the research department. And he recently returned to his first institute as from when he was a student, so he recently returned to IFPRI as a senior research advisor. And his main areas of research are on the economics of safety nets, school feeding being part of it, and nutrition-sensitive social protection programs. So today's Dr. Alderman seminar will present us the broad perspective on an understanding of social protection and safety net systems to achieve Sustainable Development Goal 2, with a particular focus on how nutrition and social protection programs contribute to the long-term development growth. This seminar will review the multiple benefits of social protection and safety nets and the way to optimize the support for the government's decision to achieve impact at scale. Dr. Alderman will conclude his seminar by providing a perspective on homegrown school feeding, which is linking the school feeding with the local production. So homegrown school feeding as a cost-effective and nutrition-sensitive social safety net. Just a few words on IFPRI, the International Food Research Institute, which is a well-recognized international research center, part of the Consultative Group on International Agriculture Research, CGIR, consortium, which is a worldwide partnership engaged in agriculture research for development. So IFPRI provides research-based policy solutions to sustainably reduce poverty and hunger and malnutrition in many countries. And there is a corporate partnership between IFPRI and WFP, which results in collaboration in many countries on joint evaluation, assessment, specific research on WFP programs. So now let me give the floor to Dr. Alderman for his lecture on making social protection nutrition sensitive. So Shnura Kalutsun, thank you again to all of you for your participation. And we're looking forward to the fruitful discussion. And Dr. Alderman, now the floor is yours. Thank you.
Thank you very much. I'm very pleased for this opportunity. One of the highlights of this very interesting 2 weeks I've spent here. What I want to talk about is how to use social protection, which is not generally considered part of nutrition. Okay, how's that? The issue is, why do we use social protection as part of the toolkit to address nutrition? And that comes a bit from the Lancet Review of Nutrition, where they took 25, 30 global experts on nutrition, said, what are the 10 best programs, so we have the most amount of evidence on nutrition? What if we were to scale that up to cover 90% of the at-risk children in the world? What would that do? And their study said it would reduce stunting by 20%. Now that's a major improvement, but it's clearly not what we want. We wanted to reduce it by, if you look at the MGGs, the SDGs, 20% is a fraction of what the goal is. So there are needs for programs besides these 10 core nutrition interventions that will address the determinants of undernutrition, and that's where nutrition-sensitive social protection, among others, comes in. The potential for this comes, firstly, from its scale. Over the world, nearly 2 billion people receive some form of social assistance. In addition, this social assistance is it's almost always poverty targeted, but it often enhances the role of women, empowering women who then can make better decisions on nutrition. In addition, many of these programs have design features which can be tied to nutrition-specific programs, and I'll give some examples as we go on. Finally, social protection increases productivity in the country, increases the growth of GNP, which in the long run will reduce undernutrition. And look, and I mentioned the scale. Globally, if you look, the lighter figure is the most recent. Globally, over the world, countries have been increasing the expenditure on social protection all over the world. And coming a bit, unfortunately, on agriculture and transport expenditures, but the point I'm making is that the amount of expenditure, the share of budget that goes to social protection all over the world has been increasing. So we want to be able to use these expenditures more effectively. I should mention that when I'm talking here, I'm talking about safety nets, the core, the circle in the core. Safety nets are only a subset of social protection policy. Social protection policy includes child services, measures to decrease child labor. It also includes a number of social insurances, which the difference is social protection is usually you don't pay for it yourself. It's usually, while social insurance, you contribute, as in an insurance thing, you contribute to a fund, which when you retire or when you're unemployed, you then draw from. So social protection is a subset. It's a subset of the entire equity strategy in any given country. But if it's part of the equity strategy, and I've drawn it here as deeply embedded in it, you want to, of course, design it as effectively as you can. It's also something which is over the life cycle, from programs for pregnant and lactating women all the way to the elderly. Now, I'm going to discuss a little later on, that becomes a dilemma, because choices have to be made at what type of program you want to put the majority of your resources. And in different areas, in different parts of the world, they make different decisions. And I will get back to that a bit near the end. Now, why? How would social protection work? How can it affect nutrition? Part of it is basically that when you get more money, you buy more food. That's basic. I mean, that's been known for time immemorial. In addition, depending on the design of your social protection, it will increase your utilization of health services as well as purchase more food. In addition, and I'm going to give briefly some evidence on that, it turns out that people who receive social protection assistance tend to actually spend more on food than they would on other ways of earning income. And I said, there's examples. There's also that you can tie social protection programs to communication strategies on nutrition, as well as to fortify with micronutrients. And I will elaborate on that in just a minute as well. But it's important, it's central to understanding where social protection fits in, to realize that nutrition has multiple causes. The basic cause, and UNICEF has used the model for now a few decades, people have refined it slightly, but the model is the same. There are basic causes, the economic and institutional framework of any country, are the basic causes. But there's underlying causes of malnutrition, can be summarized in three categories: inadequate food, poor access to health and sanitation, and inappropriate childcare. If you think of nutrition as food alone, you miss many ways of addressing undernutrition. And that is often how people think of undernutrition, as merely a lack of food. But it is more complex, and social protection programs that are designed to address nutrition bear that in mind. Income transfers, income alone, is not the entire story of undernutrition. And evidence from Armenia indicates that. This is from the 2010 Demographic and Health Survey. There's another one that's just being analyzed, but the story is likely the same. Not only has malnutrition increased slightly from 2000, but if you see here that even the highest wealth quintile, the people with the most amount of wealth that were surveyed, have high levels of stunting. Surprisingly high. And in fact, they have higher levels than some people who have less wealth. And this is even more of an issue for anemia. If you look here, as your wealth goes up, the chance that your child is anemic increases. This is from the 2005 DHS. I didn't see the data in 2010. I don't know how much that pattern has changed. But again, the same pattern is true for adult women. Women who are bearing children and run risk of hemorrhaging during pregnancy. The wealthier women have a higher rate of anemia than the poorer women. I haven't seen this in many countries. This is a stunning pattern, but the pattern in general, that wealth and income doesn't by itself eliminate the risk of malnutrition, is a global pattern. Part of the story has to do with childcare, has to do with information about nutrition. And again, this data comes from DHS. You'll see the two numbers that I have in red. exclusive breastfeeding, which is recommended globally, even in high-income countries. Only 35% of the Armenian population has exclusive breastfeeding. They have some, but not exclusive for those 5 months. It actually should be 6 months, but the way you collect the data is up to the 5 to the end of the 5th month. And then the minimum acceptable diet for, at the bottom of this, for weaning age children is also low. What that means is it's diet diversity and frequency of meals. A young child needs to be fed more than 3 times in a day because of the size of their stomach. This type of information needs to be conveyed, and it's something that doesn't automatically come with increased income. That's the reason why income is part, but not the entirety of the story. So, what do we know about safety nets? Again, from a global experience, safety nets are almost always targeted to the poor, and the ability of countries to get safety nets to the poor is pretty good all over the world by now. Usually the poor will spend half or more of any increased income on food.
Please keep the mic closer.
Okay, thank you. I was wondering. Okay, sorry. But I should mention, there is not evidence that when somebody receives a safety net globally, they cease working. Now, this is something that I've heard people object to all over the world. Most safety nets are 5, 10, even in places like Mexico and Brazil, 25% of income. You can't live on a safety net alone, so you don't become idle because you get a transfer. It is a top-up to your labor. Also, I should say that the legends that go about, the anecdotes that people drink or smoke from this transfer of income, evidence isn't there. People who were smoking before, when they get a safety net, they don't stop, but they don't do it more because they're receiving a safety net. What they do more of is purchase food. Studies from all over the world say that somebody who earns a bit of money and somebody who gets a safety net of the same amount of money, the person receiving the safety net tends to spend more on food. It nudges them, even if there's no particular stipulation, it nudges them to focus on food purchases. It's a behavioral change. Some of it is due to increased access control of resources by women in some countries, but this is something, this nutrition labeling is global. It's been observed in, as I said, all over the world. There have been studies of cash transfer programs in Colombia, Ecuador, Mexico, Nicaragua, all of which document that people spend more out of safety nets on food than they do from other income. That's true in the United States on its food stamp program. For 30 years it's been shown food stamps tend to be allocated particularly towards food purchases. Even though in principle you can take the food stamps and spend it on food and then take the rest of your money, which you were going to spend on food, and go buy cigarettes or something. It doesn't happen. But the downside of this, it's been documented in dozens of studies. People spend more on food out of safety nets. People tend to go more to healthcare centers when they receive safety nets. However, the data does not show that it increases anthropometric measures of nutrition as much as is expected. Anybody working in nutrition is disappointed and is trying to figure out why that is. However, it is well documented. This is from an early study of some of the cash transfers, conditional cash transfers in this case, in Latin America. People did growth monitoring, that's that big column in the center. People increased their health visits. They were sick a little less, but the reduction of stunting, which was the objective, was extremely small. Now this is a puzzle, and I'm trying to get, explore, dig deeper in why this is. This is the same figure. This is, though, not just conditional cash transfers. This is unconditional cash transfers, even food for work. This basically, those gray bars are the statistical range of the data, but the average over these, I believe, 19 studies is virtually zero as far as changing in stunting. I was surprised to see this data. I hope that you're also surprised. Now, why is it? Okay, there are some lessons on that. When transfers are focused on younger children, and I said there is some issue on your age-based targeting, the impacts are greater. Often people are targeting towards children on transfer programs, children 0 to 5, when your growth velocity, your risk of stunting is greatest the younger the child. Nutritionists tend to focus on children under 2. So if you're providing a transfer to increase the nutrition of a children 4 or 5-year-old, you are not likely to have the same impact. If you require somebody who gets a transfer program that they have to go regularly to growth monitoring, and all you do is write down that data and then take it for the next person and the next person and provide no counseling, as is often done in conditional cash transfers, you check off a box, but you don't give any services to that household. Growth monitoring of recording information is not counseling. Counseling is very useful. One example of using this information, Peru, which has had a conditional cash transfer and found very little impact on nutrition, reorganized it. Instead of doing a program for people 0 to 5, they did it 0 to 3, as well as pregnant women, actually. They narrowed it down, and they spent more time on counseling, providing information as well as cash, and then the programs had measurable impacts. The importance, again, is our behavior change communication, and in many cases, supplementary programs or complementary feeding of foods that are suited particularly for the dietary needs of young children. Because the average family diet is different than the needs of a young child who needs a higher density of nutrients, again, partly due to the size of their stomach. I'll give 2 examples to go further on this. On behavior change communication, there's a study done recently in Bangladesh where they provided cash support to some households and they provided behavior change communication to some households, and they provided both to some households. The households that received cash bought more food, but there was not a decrease of stunting. The households that got behavior change communication, they may know more, but they didn't have the resources to implement that knowledge. Only the households who had both the communication of nutrition information and the transfer showed that they had an improvement on height for age or decrease of stunting. That combination is much more important than either alone. On supplements, I mentioned that studies of conditional cash transfer have not seen impacts on nutrition. The one that is most studied in the world is the Progressa Cash Transfer Mexico. It was done in the 90s, started, it's still running, they've changed its name a few times, but the program's still there. Initially, there was no impact on stunting, even though it's targeted to the poor. But if the households who received a cash transfer also received supplementary food designed for children under 2, those households improved their nutrition, particularly the children 12 to 36 months. not older. Another thing I've mentioned is fortification of safety nets, particularly if you're providing a safety net in terms of food itself. School meals are a perfect example of that. School meals are not in terms of cash, but in terms of food. Tends to provide an opportunity, a unique opportunity to get micronutrients to the household and avoiding any mandatory global or nationwide fortification. One example comes from the Indian state of Gujarat, where the law said that the flour in 3 types of transfer program had to be fortified. That's the public grain distribution, the midday meal program, which is by Indian constitutional required for everybody, and in their main child care program, the ICDS. What they found when this program was done, it reduced inadequate iron intakes by 94%. It virtually eliminated inadequate iron intakes. Extraordinary impact, actually. And I should mention, very cheap. There was initial resistance. I don't think anyone in this room would be surprised that there's resistance to change of food policy. The resistance came particularly from small millers who would see that they would get increased competition from the larger mills. But they didn't say, hey, we're going to lose a budget. What they said is, you're going to get a food you don't like. The courts in India, who were very activist courts, said, no, that's not really the case. And when the program went in, surveys showed that people didn't even know there was a difference. That the food was not discolored, the taste did not change. As I said, what did change was the iron status. Yet, in India, where they've had 10 different programs, because each state has a separate program, of the 10 state programs that have been done in this century, 9 of them were discontinued. It has to do with budgets, and this is not just India. The issues are not technical. The issues are budgetary and government commitment. A good example is Egypt. Egypt has one of the largest wheat subsidies, flour distribution systems in the world, and has had that for decades. Recently, for a number of years, with the help of the World Food Program, it put in iron fortification in its flours. When the World Food Program's contract agreement, memorandum of understanding ran out, the Egyptian government did not pick it up. It just stopped putting the fortification in. And I believe it's waiting for the World Food Program to come in and pay for it. And until that happens, they may be sitting on the sidelines. Again, as I said, the issues are not necessarily technical. They are political, administrative in most cases. So, going back to foods, to school feeding. School feeding is only one of many. I've been talking about conditional cash transfers. School feeding is only one of a set of different types of safety nets. I won't even talk about public works, which in Africa is again a large type of program. I'll leave that off for this particular talk. But school feeding, you can consider it to be a conditional support. You have to go to school, and then you get a support from the state or from NGOs. Globally, something like 350 million children in the world every year are receiving school feeding at a cost of $75 billion. And this is in almost every country. Upper income countries in Europe and the United States, low income countries in Africa, middle income countries, it does not matter. School feeding is global. Generally, it's known they'll have an impact on school attendance, where attendance is low, where enrollment is low. In the United States, where enrollment is mandatory, obviously will have no impact on enrollment because it's already 100%, an issue very similar to here. But the impact on nutrition of school meals is actually not that great. Nutritionists in general have some concerns about school feeding programs. Part of the problem is that the children in school are not in the age of risk of undernutrition. And, moreover, they are, in many countries, at the risk of obesity. The school feeding program in Brazil, for example, has been retargeted, reoriented to address obesity, to get diet diversity in there, because at this point, that is the greater risk at the age of people who are in school. But in some cases, school feeding does address undernutrition in that there's two ways it does. One is that by giving resources to the school-age children, the households have more resources to share with younger siblings. And I've done a study which in Burkina Faso, which shows that if your brother or sister's in school and getting a school meal, the younger children have a reduced risk of stunting, because the household has more resources in general. There's another way that school feeding can affect nutrition, and that's because at any age at all, children and adults for that matter, need micronutrients. And school meals provide an opportunity for iron supplementation or fortification. And again, I've been involved in this study in Uganda, which provided iron-fortified flour. It was the baseline, the grayish bars, were prior to the program. When the program came in, we came back a year and a half later, that's the dark blue bars. Those areas, the first two, called SFP and THR here, just the type of program we had, anemia reduced. In the control group, that's the one on the right, anemia increased because these girls entered puberty, and a young woman in puberty has a high risk of anemia, and she loses iron in menstruation. The program prevented that risk for those who were in the school feeding program. There are other ways innovative school programs can be a platform for nutrition-specific interventions. One set of studies in China, a school provided daily micronutrients. The children were provided tablets with the parents' knowledge, of course. And what they found is that the hemoglobin levels, that's the one measure of iron status, it's the easiest one to do, they increased. But more important, from the standpoint of the designers of this program, test scores increased. People who got iron supplementation did better in math. And those who had the lowest amount of iron in their blood at the beginning of the study improved the most. The dose dependency, as it were, the type of that. The same group of researchers did another study where they didn't provide any supplementation. They merely provided information to principals of the schools, and they said for some of them, we will actually give you a little extra money if you're able to reduce the anemia rates of your students. You figure it out. What happened is just providing information led to reductions in anemia as the schools knew more about it. Providing information and incentives to the principals led to greater reductions, as they had an incentive to transmit that information. But again, what it said is the school was used to provide information on nutrition, to use that opportunity in addition to the regular curriculum of math and language and literature, whatever else is studied in the schools. They provided information on diet to success. Another type of information that can be done in schools that can be linked with school feeding, although the program is not a daily program, and that is deworming. There's a particular famous study in Kenya where they provided deworming medicine to children in schools. They found that the children who received the program had increased attendance. Their brothers and sisters who did not receive the deworming medicine still had lower worm loads because there was less transmission. But more important, because they have now followed this for 20 years, those children who received the deworming in school worked more as adults, and those who are in the wage market are earning wages 20% higher than those who did not receive the deworming medicine. The long-term impacts, the productivity increase of addressing these issues in school are measurable, which is what I want to discuss now. There have been a lot of studies, and this is an example of benefit-cost ratios of intervention programs. What a benefit-cost ratio is for every dollar you spend, how many dollars of benefits do you get? The higher the ratio, the more favorable. Unfortunately, everything, like everything else in the world, is not simple. If you're doing it, you have to say, $1 now is not the same as $1 20 years ago. If I tell anybody in this room, I'll give you $1 now, or I'll come back in 20 years to give you $1, you're going to say, I'd rather now. You come back in 20 years, I'm going to want $5 to make me worth that way. That's called a discount rate. You don't directly observe, so any benefit-cost ratio of investing in nutrition where the gains are over a child's lifetime, you need to make assumptions. So you have to do sensitivity analysis. You also, if it's going to save a life, there are protocols of how to value a life saved. Now, I personally don't like to do that. I don't want to put any dollar value on a life saved. But sometimes for exercises one does, but let's just say this is a dolly. That is, for every year of life expectancy that's reduced, it's worth a certain amount of money. Basically, all you need to know in this, over these various sensitivity, is that all of these ratios are well above 1. Means that for every dollar you spend on micronutrient supplements or fortification or deworming or nutrition education, you get back far more than you pay over the long term. I'm going to dwell on this a bit because I think it's very important. I'm going to use an example from the Copenhagen Consensus. They've run a few of these actually. They took experts in different fields and they said, give us your best estimates of what are the investment possibilities in your field. And of course, somebody who's an engineer is going to argue for building dams. Somebody who's health is going to argue for health. So they got some judges who were supposedly neutral. A team of economists, including 3 who had Nobel Prizes in economics. So they know their numbers. By this committee's consensus, only addressing HIV/AIDS 2004 had a higher rate of return than investments in micronutrient deficiencies. Okay, they did this again. They took a wider set of issues. These are the type of issues they put the first time. Trade reform, migration, governance, not just in health, comparing across. But they did this again in 2008. They put a new committee together, 5 Nobel laureates this time. And they looked at 30 different interventions. Again, they are not in health and education alone, these social sectors. They are what people call productive sectors. What they found is productive sectors are not necessarily the most productive. These are the top 10 investments by this committee. You'll see of the top 10, half of them were in nutrition of the different fields. Micronutrient supplementation, fortification, research on micronutrients for agriculture, deworming, community-based nutrition programs. that had higher rates of return than trade reform, which many people consider important, politically debatable, but anyhow, you don't even see the roads and port rehabilitation in the top 10. They don't have the rates of return. Now, before I go on to change subjects a bit, I want to say that when I present this type of information to a minister of finance, they say that's all well and good, but we want roads because we want growth. It does not seem to get over the bias that growth is something where you can cut a ribbon as opposed to help a child become more productive. Why is it? Why do they become more productive? Because that's the issue we're talking about. Even if you leave out the fact that nutrition saves lives, and I think we should not deal with that in the economic analysis, not only because I don't want to put a dollar value on a life saved, but because fortunately child mortality is declining in the world. But that doesn't mean that there's still not a major reason to investing in nutrition, because it increases productivity. Well-nourished children, when they're well-nourished at 2, by the time they reach school, they enter school earlier, they spend more years in school, and they learn more in school. There is a well-documented link between nutrition and IQ. That's been true for breastfeeding, even in the United States and England, never mind low-income countries. It's true for iron fortification and for iron. Indeed, iron is one of the few micronutrients where you can show, even among adults, that productivity increases. They've done experiments where they've given iron supplementation to road workers, and the road workers achieve more soil moved or more feet dug when they're supplemented. It's one of the few cases where you can show that you can get in returns to your investment even when they're out of the childhood. Another type of program, changing subjects a bit, for school feeding is homegrown school feeding. I've mentioned that school feeding has the goal of improving nutrition in some places. It has the goal of increasing schooling. And it has the goal of being a social protection instrument. It's a transfer program. Addresses hunger. There's a new goal that is being done on homegrown school feeding, and it's one being considered variation in this country. It's to increase farmers' income and integrating communities into the wider national market. It comes with some trade-off. It has the potential of increasing the demand locally and therefore raising the income of small farmers. It has the potential, but it also has the risk. It's because fortification, if you want to do fortification, it's easier done centrally than decentralized. It's not impossible. You can address it either by, in the process of cooking, you can address it by diet diversity. Eggs particularly. Meat, those are very expensive. Very few school feeding programs actually purchase these and put them into their program. So there are some trade-offs that you have to consider. Another issue has to do with homegrown school feeding is, can you establish the contracting? Can the local communities get an assured supply? Now this is an issue, I've done a lot of work in Africa, where you have seasonal food shortages. And the local community can buy the food 2 months after harvest, no problem. 8 months, 10 months after harvest, they have a harder time. But this is a general issue, but this is again trying to get school feeding to have one more objective. But going back now to conclude on social protection and nutrition questions I'm going to put out for consideration. How in Armenia can you make social protection more nutrition sensitive? Generally, can you tie it to behavior change? Can it become a tool to encourage women to take counseling sessions? prenatally or when they've got an infant in the arms to learn more about complementary feeding, for example. Can it be used? You're working now in Armenia at establishing social service centers. Get paperwork done, all sorts of administration things, you can do it in one place. Can you use those centers to provide nutrition information? There should be a question mark there on that slide. I'm raising these all as questions. Okay, you're talking now of having, in addition to the cash benefits, a top-up family benefits for pregnant women and children. That current discussion, it's my impression, is to children up to 5. Since I think that children up to 24 months or 36 are much more responsive to these programs, every country, no matter where you are, has a limited budget. You spread out the same budget over more people, it's a smaller amount to the younger children. It's a question that is a political question. What are your objectives for these programs? If it is to increase your resources to the most vulnerable nutrition children, I would go for pregnant women 0 to 2 or 0 to 36 months, but not to 5. That's another issue. But those children who are 4 and 5, they are in kindergartens, many of them. If you want to, many of these kindergartens are community-based programs. They don't get the resources from the central government that the primary schools do. If you want to address the nutrition of these 4 and 5-year-olds, address the nutrition perhaps by addressing school feeding into kindergartens. That might address nutrition. It tends to have a greater impact than nutrition programs at age 8 and 9. It might also increase the enrollment, because right now you don't have 100% enrollment in kindergarten, although you do in primary and primary schools. And right now there are birth grants in the country. I haven't had the opportunity during my short visit to know how they work and what are their impacts on nutrition. But that's something that you may want to know. It's part of your social protection system. If you want to see its nutritional impacts, again, can you link it to behavior change communication? Okay, one final point to address. There are many different objectives with social protection. The primary one, all over the world, is poverty reduction. And poverty has no age limit. So countries have programs designed over the life cycle, as I mentioned earlier. However, if you want to take your limited budget and increase your nutrition resources, you may have to decide what share of your total budget goes to pensions, what share goes to households that don't have young children, and what share goes to households with young children. This is a global challenge. There's no one answer, but it is one that has to be considered if you want to match your poverty reduction with long-term productivity gains that can be established in nutrition. Thank you.